Well, I want to thank all of our speakers again. Very fascinating presentations. Sorry to end on a bit of a gloomy note there, John, but we do have some time for questions for those in the audience, and I certainly have some, but I think I'd like to turn to the audience first. There's one in the back there.
Yes.
Could you identify yourself, please?
Richard Hoff, Capital District Alliance for Universal Healthcare. The Urban Institute completed a report last year on the most effective way to fund healthcare in New York State. And I believe single payer came out as the best way. Is there a chance that the Sanders amendment to allow single payer discussion in the states will be affirmed, or will there be any movement towards that possibility?
I don't think so. And it's, you know, if you're a proponent of single payer and all the advantages that, you know, we talk about potentially coming with that, it's probably disappointing. But I mean, a single payer has been a non-starter, in my opinion, in this debate in Congress from the beginning. And in fact, the recent idea to expand Medicare back to 55 got enough senators queasy about sort of starting us on the road to a single payer system that you know, that sort of rhetoric, I think, you know, was one of the things that sort of swayed us back from looking at this idea of Medicare expansion. You know, one of the things about, you know, I just want to say, because the whole idea of the public option was something that, you know, everyone sort of had a lot of faith in. But when you really look at what the CBO did with it and its estimates, I mean, even the public option wasn't going to be the thing that saved us all. You know, the CBO estimated only 3 million people would transition over to a public plan, and so, you know, the idea that either single payer or a full-blown public option would, you know, be something that would be in the final bill and make a big difference, I think was perhaps a little overstated. But it's too bad. I mean, I don't think the single payer, frankly, ever got the time for debate that it merited in the whole discussion. But I think at this point, I don't think you're going to even hear the two words now come up on the Senate floor.
One word that we did hear a lot today was related to cost. And so I was wondering, given your view of what some other states are doing, Massachusetts, for instance, are there some things that New York might undertake in the next few months? And sorry to put you on the spot, Wendy. Maybe John has some ideas about what they're doing at the county level. But what kinds of things can the state or the counties do in that area, do you anticipate in the next year or so on their own without federal reform?
I think this is an area where all eyes really have been on Washington, and we're looking to see what's going to happen there. And with things moving quite as quickly as they are with the times moving, and the vote supposed to happen in the Senate before Christmas, I think at this point we've really been focusing most of our efforts there. So.
Another question in the back.
My name's Bob Westphal. I'm mostly retired professor. Do any of the panel think that given the current mechanisms and operating procedures for electing Congress and other legislative bodies that we will ever see a reasonable public policy decision come from that body?
I will let the person who doesn't work for an election.
Well, you know, I go back to Thomas Friedman of New York Times being quoted a lot recently about a column he wrote, I guess, a little while back that basically said, you know, our system of government now, we're at the point where it's difficult to find the optimal solution to big problems, and it's difficult to get the optimal solution to even be discussed, much less passed. And the concern is, I think a lot of people with healthcare reform is, yes, we are going to get something, and as John said, and as I believe, it is better than nothing. It really, I mean, you're talking about still insuring a lot of people in this country, but it's much, much, much less than what I think some of us thought it could have been, given the way the stars were aligned. And I think that says something about where we're at in terms of how laws get made and how legislation gets passed. And so, you know, I think it's a suboptimal step, but it's a step in the right direction. So the question is, if it's followed by more suboptimal steps taken together over time, maybe we can get to a solution that works, but.
I'm a sub-optimist.
If I could, I'll step gingerly out on a branch. The health economist, Uwe Reinhardt, has famously said that somebody's healthcare spending is somebody else's healthcare income. The debate that we are engaged in Albany County over the future of long-term care in Albany County is a case in point. We can have honest disagreements about what direction we should be going in, what the mixture of services should be, and all that health want stuff. But when we're talking about cost control, that means somebody, at best, that means somebody's income is not going up. At worst, that means somebody's income is going down and potentially to zero. These aren't easy changes for any system to go through. And this is playing out in the public sector. This is not, the faceless market or the invisible hand. We're talking public money, public issues, public options. These issues necessarily play out in public and in politics.
I think that there's lots more time for discussion, but I know that people have schedules to keep, so I think I'm going to have to cut it off at this point, and then I'll promise you that we will continue this discussion because implementation is going to take several years. So please join me in thanking our speakers.